who you're going to trust with your health data. I mean, we heard a couple of years ago, that Microsoft and Google were going to get into, healthcare and transmitting data. We know about electronic health records and how a lot of money is being pumped into that area to make electronic health records more ubiquitous and better running. You heard about personal health records. It's been peppered through our entire morning in conversation here. So we've put together this stunning panel of people who are all very knowledgeable in this area to talk to us about this whole area of who do you trust with your health data. And so at this time, it's my honor to introduce John Moore. John Moore is the founder and managing partner of Chilmark Research. John is which is a healthcare industry analyst firm. John is currently leading research on understanding the concurrent roles and impact of consumer-driven health and consumer-centric technology in the healthcare market, with particular focus on consumer-facing healthcare technologies. In May 2008, John authored a report, IPHR, Market Analysis and Trends. He currently is working on a report, Health Clouds on the Horizon. Oh, this looks like a panel for next year, John. To be published in fall 2009. The report will look at the market implications of key consumer-facing healthcare platforms from Dossia, Google, Microsoft, as well as some of the smaller or at least less visible platform initiatives. So I welcome to the stage John, because my voice is starting to go.
Thanks, Susie. Okay, well, good morning, everyone. This is the last session before lunch, and we have quite the panel here with representatives certainly from Dossia and from Microsoft's Health Vault, as well as from Kaiser Permanente. And then we did have someone originally on the agenda, I believe he was from Walgreens, who I guess could not show up, but we do have Chuck Parker from the Continue Alliance, who you were running a session earlier when I came in. So I just want to give you a quick format of the session, no presentations. What we'll do is have each of the panelists give a quick overview of kind of their perspective on this particular topic of who will you trust with your health data, and then we'll go into some Q&A that I've prepared and reserve the last 10 minutes or so of the session for your questions and answers. So to get started, one of the things I wanted to do before we launch into the panel and the questions, I did a little research on privacy of health data. And I did some searching on the net, and one of the places I went to was a place called privacyrights.org, which has a listing of all the various privacy breaches, whether it's financial, medical health records, what have you, that has occurred in any given year. And for 2009, looking at just medical records, there was a total of 80 million records compromised in 2009. Now, there's a bit of an outlier here in that the VA, the Veterans Administration, sent out one of their hard drive servers to get repaired. Well, they inadvertently sent it out with 76 million records on it to an outsourced service provider to repair it. So those records are basically put out there into the public domain and compromised to a certain extent. But if you subtract out that outlier, we still had 45 breaches. And if you divide that by about 4 million, you end up with about 90,000 records compromised per breach. And just to give you an idea of another example, in May in Virginia, the Virginia Department of Health Professionals, their website was hacked. 530,000 records were compromised, and the hackers have been holding them ransom for $10 million. I'm not sure, the hackers have not been caught. I'm not sure if they paid the $10 million or not. There's been no real talk about it since then, but this has occurred. And if you look a little deeper at some of the breaches and what's occurred, you usually find a lot of it's being done internally. Either laptops are being left in a car or being stolen that have records in them, or it's an employee selling records to, guess who? Ambulance chasers, lawyers. Seems to be a very popular market for health records. So, another data point I gathered was I went to the HHS site, Human Health and Human Services. They have an enforcement division for enforcing HIPAA compliance. HIPAA is one of the regulations that was signed into law for securing the privacy and security of public personal health information. Since April 2003, they've had over 9,600 enforcement actions of some type. So, and that's been going on for quite a while. So that's since 2003. So we're seeing over 1,000 actions being taken by HHS per year in this regard. So it makes you kind of wonder, okay, how private is our personal health information? And if you can't trust the VA, you can't trust the Virginia Department of Health Professionals, who can you trust with your data? It kind of raises some thorny issues here. But there's one last point I wanted to make, and that is in 2009, the American Recovery and Reinvestment Act was passed, ARRA, or the stimulus bill. In that massive bill, there's over $40 billion will be spent in the United States over the next 5 years or so to digitize doctors' offices and hospitals. So that's going from a paper-based system, which we have, it's very common in use today, as right now the adoption of electronic health records technology in medical practices is below 20%. So as we see this massive influx of billions of dollars going into the market to digitize these records, we're actually creating more liquidity of records, which gives even greater potential for breaches, I believe, versus paper records. So that's kind of setting the stage of where we are today. And what I would like to do now is turn it over to the panel, and we'll just go down the line starting with Colin, and I have each of them speak for 2 to 3 minutes about, from their perspective and the organizations they represent, how are they looking at this issue of privacy of personal health information. So.
Okay, John, thanks. Good morning. My name is Colin Evans. I run the Dossia organization. We were a group, for those of you who don't know, that was set up by a number of large employers who are looking at the spiraling cost of healthcare as being a pretty major bottom line issue for us, and we've heard several of the panelists this morning talk about that. We have 10 large employers that help create Dossia, Intel, AT&T, Walmart, a bunch of other companies. Our goal is to gather information together to help give people the tools to make better sense of their health information, to empower them as individuals to change health and healthcare, change health, as many of the folks this morning have already mentioned, to get better information, to become better stewards of your own health, to think more about health, but also to become more demanding consumers of healthcare. Healthcare, for the most part, is organized for everybody's benefit but the patient. And so we're trying to redress that balance a little bit, get people to make better use of the 7 minutes they get with their doctor, and maybe avoid a test, get a generic drug, save some money, become healthier. As someone running a company that's producing personal health records, I'd love to believe that everybody every morning got up and said, boy, I wish I had a personal health record. In fact, chances are people don't actually ask that question in the morning. They ask themselves, I wish I could figure out whether Granny took her pills, how do I get my weight down, can I measure my cholesterol, can I get some advice and help for my, particular medical condition and so forth. So when we look at what it took to get information and tools in the hands of people, we really ended up with sort of 3 things we thought had to happen. Number 1, people need useful, targeted, helpful, fun, engaging, relevant tools and services and applications that mean something to them, not just a one-size-fits-all personal health record system, but very specific things for if you deal with a pregnancy, deal with diabetes, deal with depression, deal with whatever is your particular condition.